Good morning, good evening, good night, everyone. Agers, older persons, family caregivers, entrepreneurs. Welcome back to Lana's Little Things. You know me, Dr. Lana, specialist gerontologist, talking all things on living agelessly and breaking, breaking, bridging generational gaps, entrepreneurship, family caregiving. There's so much to say, and just life itself. So I hope you're well. For those of you overseas, it's getting warmer, so everybody should be enjoying the sea wherever you are. Enjoy. What we're talking about tonight, we're continuing our discussion on Parkinson's disease. I thought because again, it's like the little cousin of older age that, which is not a normal part of aging, because aging is not a disease, it's a process, but things can happen in our brains and any part of our body as we age. So with Parkinson's disease, it's there's so much to it, there's so many aspects to it that it makes treatment and management challenging. But let's talk, because it's not impossible. So if you have signs of Parkinson's and you're finding it challenging, put it in the comment below. Contact me. I'm easy to find at Land's All Things, and I'll leave all the links below. If you're a family caregiver and you notice or you have someone who's been confirmed with Parkinson's disease, speak with your doctor, stay in close contact with social workers, close contact with as many family members as possible, or close friends, because this is it's ongoing and it's unpredictable in terms of how long is it going to last, what's going to happen. So let's just briefly remind ourselves, because we did this last week, about what Parkinson's disease kind of really is. So it's a disorder of degeneration of the brain nerve cells that disrupts their connection. It's and and then it confuses like where how things would be meshing, your processing information. Movement is a big thing, language, writing, speech, and later understanding. All those are signs are the reasons, are the things behind, are the signs of Parkinson's disease. And that's because the particular area we have spoken about looks like a butterfly, kind of the front side of the brain. But there's also a chemical that is disrupted, and that's called dopamine. You may have heard dopamine many, many times as a treatment or for depression, or people say they get their if they're in a rush or they're high or whatever, it's a dopamine surge. And this is kind of like a feel good hormone, but it's if it's disrupted, then then things are gonna go wrong. If it's happy, if dopamine is a happy drug, well then if we lose dopamine, then it's not so happy. So the aim in Parkinson's disease, the primary thing, the one we can treat, is to give you what's missing, which is dopamine, and that in many combinations, carbidopa, levodopa, those are many things. Brand names, you can check them all out. However, bear in mind, Parkinson's is not curable, but it is manageable. Don't despair. You can manage the symptoms. You can manage it. You can get through. As time progresses, it gets more challenging. So anyway, you know the things: the resting, the tremor, the shaking of the hands, the shuffling gait, the slowness of movement, slowness of speech as they try to process what's going on. It's not a form of dementia, but it can be combined with types of dementia, so it can be confusing. But generally speaking, it has its own characteristics, and the main one is tremor. That resting tremor of the hands, and the hands just can't stay still, especially fingers. And or they do the or this all the time, pin rolling. Just a tremor of the hands because it's just trying, the brain is just disrupted. Stiffness and rigidity of the joints. Oh boy, that makes, if you're a caregiver, oh, that makes going to the, helping them to go to the bathroom, helping them to go to the bedroom, helping them to go to the kitchen, anywhere, if they do need help, it can be a struggle because the limbs are like resisting you. And in their mind, sometimes they're scared to walk, so they're resisting and pulling back. Oh, it can feel very disruptive. So, right, we just breathe and go with the flow. Remember, because they're unstable and unsteady and scared to move, they're not going to walk straight. They're not dizzy. You can always check that out with the doctor. If you know that they have enough fluids to drink, then in Parkinson's disease, you're, remember that gait, walking and balance, all those are disrupted. All right, and we spoke about earlier cells that causes that can show you that dementia early on, which is, which include constipation, smaller handwriting, loss of interest, you know, those sorts of things. So let's let's talk about something positive for a change, and what can be done. We generally treat, as I said, dopamine. We have medication for that, but it's kind of also medication that might need to be added because of hmm, because of, we treat what we see. We can't cure this disease, but as things manifest themselves, sometimes persons will need more than one type of medication. Hmm. So that is because the motor system, the walking, the stiffness, all of that comes into play. You know that also in the brain, because it's changing, it's also going to be changes in mood, changes in behavior, uh, sleep disorder. Oh, sleep disorder is something else. The blood pressure can go low. They're not tracking what you say, and it's very disruptive. So how? Because it causes unknown, and there's no cure. What can you do? What can you do? So we're going to talk about at least four top things that you can do in Parkinson's to manage with a loved one who has Parkinson's disease. First step, please understand the disease itself and its progression. It progresses even with medication because dopamine is just, it's going down, and a medication can only do so much. You can't take too much of it either because it does have other side effects. I mean, not everything, but if you gotta take it, you gotta take it. Why is that important? Because it adds to quality of life. We're given medication so you can move better, so you're not bedridden or confined to any one place. You can feel more independent, less unstable. Wouldn't you want that? No one, you don't want necessarily as an older person to always be dependent on others. You want to do things. So if there's something that can manage, that you can manage it. The sad thing about it is that we only find out most of the problem way later in the disease process. So the earlier signs that we spoke about will help. However, once that has happened, we've lost nearly all of that important butterfly-looking thing, organ in the brain which produces the dopamine. We can also, you can also have accumulation of abnormal cells called, which cause Lewy body syndrome. It was also found that can cause a different change in behavior. So it's so mixed. You treat what is there. So, for example, if there's depression, you might need to consult a psychiatrist. So they might be able to advise what's the best course. L-DOPA is, dopamine giving is the standard, but we treat what we see. If there's depression and the psychiatrist has acknowledged and um, concluded and diagnosed person as depression, as Parkinson's, then and with depression, sorry, then they will be able to give medication for the depression. Now we don't want to just pop pills for no reason, but we're trying to help with quality of life. It's quality of life, really. So, what are some other things that besides that medication? Hmm. If there is, remember, there's constipation, so you might need a laxative. Uh, just check with the doctor on what laxatives you can use because you don't want to go too fast if you're moving slow. Understand? There might be too many accidents. What about if the person has hallucinations? Hmm. There's medication for that as well. And sundowning if there is a element of of dementia. As the sun goes down, behavior changes, and they get very restless and anxious and want to pull at things, or sometimes they just sit there, blank stare, nothing going on, don't want to move. How do you manage with that? Well, again, it's patience and empathy, but we can manage the. It's part of depression, so again, depression medication, according to each person, may be required. If there's a problem with movement, you might need, and the limbs are stiff, physiotherapy is so good. I have so many patients who have Parkinson's disease who've gone to the therapist, and that shuffle, not right away, but it was so much easier. Well, you can't get into the brain, but you can remind the body and the muscles that they are getting some sort of movement. So even if the processing in the brain is going down, the movement will be better, smoother. So please consider physiotherapy uh, as a form of treatment, as a form of management, because especially when you're home at 12 o'clock in the morning and you need to go to the bathroom, let's be real. This is what we're talking about. A lot more research is being done right now to help with earlier diagnosis, to help with treatment. The Parkinson's organization has is a place where you can go. I'll leave that link, and they definitely have works or medication or advice or therapists and counselors and psychologists, psychiatrists, you name it. You can find a solution, a help for the person or you with Parkinson's disease. Hmm. You can't stop the disease from progressing, but we can treat what we see, as I said. So I hope this was helpful because you really. Oh, I forgot to mention. Did you know? Well, it's in the United States. It's ranked number 14 as the 14th cause of death in the United States alone. So who and the global markers are even different. So imagine a whole lot of people are going through this, not just you. And that, well, I hope is reassuring. So remember, you can manage definitely with therapy, yes, medication to replace the chemical that's missing, yes, medication as needed. If there's anxiety, definitely depression, and hallucinations. There are medications for those. Treatment to relieve the stiff joints, and also just to be outdoors, to be getting involved, go in the garden, assisted, of course. Wherever you want to be, whatever is your hobby, just remember you can do it. Slowness of movement might restrict what you do, but there's far more things to engage with. So um, play games on the computer. There's Jerry technology. You don't have to like write stuff. If you want to, you can, but there's Jerry technology that you can type in bigger letters, you can see it. So investing in things like that will help you to use them. You don't have to use your muscles all the time. Yeah. So just saying Parkinson's disease is not one of the famous parts of medicine, or and it can be so complex that you just don't know what to try, what to do. But we do talk about it, and there is light at the end of this tunnel. So from my heart to yours, please share this with a friend who might need it. If you are having, or any person in your life is having tremors, is walking slowly, is sleeping too so much, is is depressed, is not having a good mood, is just flat, moving around and endangering themselves because they might not process the mood their own thing. So it's challenging. It's challenging, but it's not impossible. So I hope these suggestions, these types, like things that you can try, that you can work with your doctor, tell your doctor about everything that you are experiencing, even if there's an additional jumping in dementia. The brain is complex. We can't get into the brain. We can only treat what we see. So that 100 times. So share with someone, take the time out, talk to your doctor, see what medications are useful, may be useful for you, and do the best that you can, aren't we all? So from my heart to yours, Dr. Lana saying good morning, good evening, good night, and do the best that you can. Age like fine wine, age gracefully, and agelessly, because aging is not a disease. Link for me on the website. You can find me if you have any emergency or any questions at all. Please leave them in the comments below. That helps me to understand what you may need and what do you suggest would be a good topic to talk about next time. Do I talk about dementia? Do I talk about caregiving? Please put on here. I'd love to hear your comments. So that's it for me. Tell a friend, subscribe, press the notification bell for when I'm coming through, and have a wonderful time. Life is